channel. Today we are going to start the reflection of peritoneum on the liver, like how the peritoneum is, reflection is nothing but how the peritoneum is forming some ligaments around the liver. So that we are going to discuss today. So for example, now we are going to see the abdominal cavity from a sagittal section. Okay, so in the sagittal section, how the abdomen looks. So let us draw it. So mainly we are talking about liver right today. So this is liver. Okay, and below this you have this one is lesser sac, right, and here lies the stomach. Okay, so this is the peritoneum. First it will start lining around the stomach like this. Okay, and this is called as lesser momentum. Okay, already in our previous videos we discussed about greater momentum, lesser momentum, right? So you'll have an idea by this time. So this is a lesser momentum which is coming from the stomach. So let us mention it as stomach. So this lesser momentum only will continue around the liver like this. This lesser momentum is also nothing but it's a double fold of peritoneum, right? So peritoneal layer only is covering around the liver. So what is this peritoneum? This is a visceral peritoneum because it is in contact with the organs, right? So this is visceral peritoneum. Then where is parietal peritoneum? Parietal peritoneum will cover whole of the abdomen organs. So this is a parietal peritoneum. So now what is happening in the liver is this visceral peritoneum which is going around the liver, right? And this is forming a number of ligaments between the liver and anterior abdominal wall. Actually, this is an anterior abdominal wall and this is a posterior abdominal wall. Okay. So first we need to understand like how the peritoneum is surrounding all the structures. So all the abdomen contents are inside this and the liver, this peritoneum is covering all the structures from outside. This is parietal peritoneum, and the peritoneum which is like covering all the organs inside, this is called as visceral peritoneum, and the organs which are present inside this visceral peritoneum are called intraperitoneal organs. Okay, there are also some other organs, like for example you can take pancreas over here, and also you can take or kidney, right? So these are actually retroperitoneum. What that means, retroperitoneum, retro means back, they are like located back of peritoneum, so they are covered only by this parietal peritoneum on their anterior surface, but on posterior surface they are not connected. So these are called as retroperitoneal organs, like you can take example pancreas, kidneys, right? So first we have understood the basic outline of peritoneum. Now let us see what are the different ligaments which are formed in the liver. So this is a basic idea. Now let us draw another diagram to understand like what are the different ligaments which are attached to liver. So mainly we are going to talk about falciform ligament. So that is the ligament which is formed by peritoneum itself. It is connecting from the liver to the anterior abdominal wall. So one is falciform ligament, other you have like right and left triangular ligaments, and another one is a coronary ligament. So all these ligaments are from the liver to the anterior abdominal wall. So let us draw that proper diagram of ligaments now. So in this diagram, if you see, this is the superior side and this is the inferior side. Okay, so actually this is anterior side, right? This is posterior side. So now we are going to draw the same liver over here, like this is a superior side and this is an anterior side. So this is an anterior superior view of liver. So in the anterior superior side of liver, if you see, liver have two lobes, a right lobe and left lobe. So this is a right lobe and this is the left lobe of the liver. So in between coming this ligament is a falciform ligament, and this falciform ligament in turn when it comes towards the downside, it is in turn divided into the right triangular ligament, as this is on right side, right? So this is right triangular ligament, and if you see on the left side you have your left triangular ligament. So these are the right and left triangular ligaments, and we have discussed about the falciform. So let us name it. This is falciform, this is right and left triangular ligament. So I said remaining one more ligament, that is called as our coronary ligament. So where it is situated, for that you can see here this right ligament only, it will turn like this downward. This one, this is the coronary ligament, the superior and inferior layers of coronary ligament. So this is coronary. So just simple, this right triangular ligament only So you can see this is right triangular ligament. It is coming like this, forms coronary ligament. So mainly we are going to discuss about falciform ligament today. So actually if you see the falciform ligament shape, it is looking like a sickle shape fold, right? So what is actually ligament in the case of your visceral organs, especially in abdomen? Actually they are not the ligaments of joints like in your knee joint, they're present. They're not for support of joint, but these ligaments are just formed by double fold of peritoneum, that you need to remember. So that's why I draw two lines representing the two folds of peritoneum. Okay, so the falciform ligament is sickle shaped fold which is connecting the anterior superior view of the liver to the anterior abdominal wall. Okay, so to the anterior abdominal wall, and to the also it is attaching to undersurface of diaphragm. Of course diaphragm will be just above the liver, right? So it will also attach to undersurface of diaphragm, also to the anterior abdominal wall. And this fold is also raised by the ligamentum teres of the ligament. You know what is the ligamentum teres? It has a small projection like this. This is ligamentum teres. Because of this ligamentum teres of the liver also, this fold of falciform ligament peritoneum is rising towards somewhat upwards, so that it can easily also attach to the undersurface of the diaphragm. Okay, and you know that the ligamentum teres is extending from umbilicus to inferior border and inferior surface of liver. So as I said, this is anterior superior surface, this is the inferior surface. So ligamentum teres is extending from umbilicus. You know umbilicus will be over here, right? So from umbilicus it will extend like this towards the inferior surface of the liver. Okay, and it joins especially the left branches of portal vein at the left end of porta hepatis, just opposite ligamentum venosum. So for example, here lies for example, this is falciform ligament, right? So here lies the ligamentum venosum and here lies porta hepatis. Okay, so this ligamentum venosum and porta hepatis, for that also like this ligamentum teres is helpful to join to left branches of portal vein at the left end of porta hepatis, just opposite to ligamentum venosum here. So this ligamentum teres, you can see just above this it is present. So there is also communication with portal vein. That's it. So by this we have completed the reflections of peritoneum on liver. Next we'll start with peritoneal cavity.